So today I'm going to be talking about macrodosing cannabis as part of phase 2 of the Healixed pain relief plan. Now, this is going to be a video where we're going to dive into the basics and fundamentals, because dosing is a very complex topic that is unique to every single individual. And so I want to give an overview of what macrodosing even means, and out of the people watching this who out there might need it, and then how to start to proceed to do your own research in coming up with the right protocol to treat the symptoms that you or loved ones are having. So first of all, when it comes to dosing, we have a spectrum of how much plant medicine you intake in order to achieve a desired effect. So typically, in terms of finding that therapeutic window, we want to take the minimum amount of cannabinoids in our system in order to get us to the desired result. So when we talk about dosing, it's on a spectrum of micro to macro. And then you'll have normal doses that will range somewhere in the middle. Now, microdoses are subperceptual, so you'll notice very subtle changes, but those are meant to kind of, shift you subtly into line so that you're in a more balanced state to kind of tackle your day. When we're going to the other opposite of the spectrum when it comes to macrodosing, I wanted to start here because this is where it gets far more complex. There's a lot of fear and uncertainty when taking a large quantity of any drug, and especially when it comes to cannabis, because of the gray area with the legality, there hasn't been as much research on various different macrodosing protocols to treat, a wide variety of illnesses that cannabis, is proven to treat. So as far as coming up with, your own strategy behind that, the first thing to understand behind macrodosing cannabis specifically is that the body's endocannabinoid system is naturally designed to uptake high amounts of various cannabinoids and other flavonoids and just plant matter that's within the cannabis plant. So why is that important? It's important because with any type of drug that's put into the system, typically there's a toxicity level where that particular drug is going to oversaturate the system and cause problems, right? So when it comes to typical pain relief plans that you're going to see out there, opioids are the typical prescribed drug of choice. When we look at how opioids affect the body, the toxicity level, it's very easy to reach that because one of the systems that opioids affects directly is, in the brain, is the respiratory system. And so when you start to get above a certain level of opioids in your system, your respiratory system starts to slow, and many times people will OD and stop breathing, and that will lead to death. So that's only one nasty side effect among many of the others as far as long-term usage of opioids. But that's an example where people will see that and they will then project that onto other drugs and other medicines like cannabis, which is completely inappropriate because cannabis does not affect the respiratory system. And it doesn't affect any system that is critical to the body's function on a subconscious level. So when you look at the toxicity level and just the amount of deaths that are related to cannabis, it's almost zero because it is extremely, extremely difficult to dose yourself to the point where you would die. Now, there are a lot of horror stories about people overdosing when it comes to THC and having unwanted side effects. But that is very different from getting to a point where your body and your life would be in danger. So that's the first thing to kind of really establish, is that any kind of high-level macrodosing protocol when it comes to cannabis, it's really one of the safest medicines out there when, and if you're trying to experiment with larger doses. It's very difficult for things to really, go horribly wrong. And really, for the most part, the worst case scenario is you'll feel uncomfortable, maybe an upset stomach, and maybe you have to sleep off, taking too much. But the idea is, when it comes to even why we would want to macrodose in the first place, the reason is because our bodies naturally in homeostasis are designed to heal themselves. So the body's natural endocannabinoid system, we produce cannabinoids naturally. But the problem is life is imperfect. So between our own psychological factors in addition to external factors, there can be severe stressors that will push our bodies and our minds out of homeostasis. When we're pushed out of homeostasis, that's when we start to have disease and illness. And the spectrum of disease and illness can also range, right? So it can be very mild, we can feel very mild discomfort, depending on our mood and our state of mind and our physical well-being and the kind of pain that we may feel. And it can also range from mild to very severe and life-threatening. And so that, very severe life-threatening, that could again apply to a wide spectrum and range of illnesses. So we could be talking about mental disorders. I myself have suffered with, severe mental disorders at certain points in my life when it came to depression, things like bipolar. Then we have a wide variety of other systems in the body that are also tangentially connected to the endocannabinoid system. So we're talking about the neurological system. There's so many cases where, the brain is affected by these phytocannabinoids and endocannabinoids. And the more we can flood our system, the more we can start to bring our brain and the resulting neurology back into balance. So, people who have severe things like seizures, multiple sclerosis, and other kinds of neuropathic disorders, these are cases where macrodosing cannabinoids can start to flood your system with the right chemicals to fight those disorders and bring it back into balance. So I could go through a whole range of different, autoimmune and various other different disorders, but the ultimate point is, with all of these, there's a spectrum to how severe that illness or disease is. And the more severe and the more off balance the body is, sometimes we need outside medicine at a high dose to now forcefully push our body back into line. And when I say forcefully, I mean that we need to have the right chemicals in order to fight these very severe disorders. Cannabinoids are well known, some of them specifically to induce apoptosis, which is the death of cancer cells. And so when you're looking at a type of cancer, that is very advanced, where, someone could potentially be on death's door, they're in severe pain every single day, that is an example where opioids are going to create a whole host of side effects that are not going to be bringing the body back into balance. They're just going to be putting Band-Aid on a level of pain that, will then continue to degenerate based on the underlying illness. When we look at how cannabinoids interact with, an illness of that severity, macrodosing has been proven over the past decades to not only stop severe illnesses in their tracks, but many cases actually help the body heal and reverse it. So there's been plenty of cases of very severe types of cancer where people started a cannabis macrodosing protocol with, either high THC, high CBD, or sometimes a 1-to-1 ratio. It really depends on what specific illness we're talking about. But when the more severely out of balance we are, typically the higher the dose we're going to need over a longer period of time to bring us back into balance. And so, within the community, you're going to see the tinctures, a variety of tinctures linked below that we use in our macrodosing protocols, the strongest being Rick Simpson's oil. And in addition to these tinctures and oils, there's also a variety of ways that we can kind of get up to that macrodosing level we want on both the THC and CBD side. So that could be taking these cannabinoids orally, that could be eating them in our food, it could be, topically putting them on the body. So there's different ways that we can increase our dosage to the desired level to combat the different types of diseases and illnesses we're fighting. So I just wanted to give this video as a very brief overview. We're going to be going over much more in-depth macrodosing protocols within our Healixed Pain Relief Plan. And we're going to be releasing much more information on that pretty soon. So if you have any questions on macrodosing, please drop them in the comments below. And I look forward to seeing you all in phase 3.